everyone, I'm student nurse Pia, and today's my reflection video on my patient. So today, during my clinical experience in the psychiatric unit, I cared for a 15-year-old patient who was admitted for following multiple suicidal attempts. Over the past 2 weeks, and during my interaction with the patient, I observed that they continued to express active suicidal ideation. The patient verbalized thoughts of wanting to harm themselves and specifically stated an intention to swallow bone. This was particularly concerning because upon further assessment, it was discovered that the patient had hidden bones under their bed and on their person, indicating both intent and access to means. So from my observation, the patient presented with a flat affect, appeared withdrawn, and demonstrated limited engagement at times. So despite this, they were able to communicate their thoughts when prompted using therapeutic communication techniques. This highlights the importance of creating a safe and non-judgmental environment to encourage expression. So the primary risk identified in the situation was a high risk for suicide and self-harm. This conclusion was based on several critical factors: the patient's recent history of 3 suicide attempts, the development of a specific plan, and the availability of means to carry out the plan. These elements together significantly increase the immediacy and severity of the risk. Additionally, there was a potential risk for impulsive behavior, as adolescents may act quickly on harmful thoughts without fully considering consequences. There was also a concern for possible non-adherence to treatment and the need for close supervision to prevent further harm. So overall, this experience reinforced the importance of prioritizing safety and psychiatric nursing care. Interventions such as one-on-one observation, environmental safety checks, and continuous risk assessment are essential in managing patients with suicidal ideation. It also emphasized the value of therapeutic communication and building trust and encouraging patients to share their thoughts and feelings. Overall, this encounter deepened my understanding of how dynamic and high-risk mental health situations can be, and the critical role nurses play in ongoing assessment, interventions, and patient safety.